Okay, so as I mentioned, thank you everyone for joining us today. Today's webinar is called Monitoring Your Oxygen System, Strategies to Track Oxygen Supplies at the Hospital Level. Today we are lucky to have 4 panelists, Trevor Cook, Monitoring and Evaluation Coordinator, Assist International, Benjin Joshua, Senior Manager of Medical Programs, Biomedical Engineer, Assist International, Gunalan, Engineer and Technical Consultant, Assist International, and Dr. Anna Crawford, Anesthesiology and Critical Care Medicine, Stanford Global Anesthesia. And so with that, I'll hand it over to Trevor to begin.
Hello all, I'm glad to be here with you today to talk about strategies and considerations for maintaining oxygen supplies at your hospitals. So the big idea for this presentation is that knowing how much oxygen and how many accessories you have, as well as monitoring key safety points, can help you provide better patient care and save lives. Before we dive into this subject, I want to talk about how we know about this topic. So over the past 5 years, Assist International has been working to increase access to medical oxygen by building oxygen production plants closer to rural hospitals. Additionally, over the past decade, we've installed smaller scale plants and worked closely with programs providing oxygen concentrators. And on a more technical note, we've also created programs to train many biomedical technicians to maintain and repair oxygen concentrators. And I think just as important as the programs that we've done is the many hours that we've actually been in country at some of these hospitals and spent many hours talking to clinicians like you. We've spent many time talking to clinicians in Tanzania, Ethiopia, Honduras, Cambodia, Kenya, Rwanda, and really it's just helped us better inform our thoughts on what good oxygen systems should look like based on the needs that have been presented to us. Assist International has also spent the last 5 years learning to track systems, educating ourselves on monitoring and evaluation. I personally have had the privilege of being with Assist International the past 3 years in monitoring and evaluation and also learning how to track health systems. I think also a really amazing thing that we've gotten to experience in this area of oxygen health systems is we've created systems to track oxygen usage at 21 hospitals across Ethiopia. And so all of this is the culmination of how we've learned about this topic, and we're excited to present to you today. So a quick overview of the presentation. We will talk about why we should monitor our systems, what it takes to be able to do this, and most importantly, how do we start? So we will spend a little time on the first 2 items, and most of our time will be on the third part. And as we continue, I want to make note that for those of you with cylinder or concentrator systems, we've created worksheets to help you evaluate your oxygen system, to help you see your needs and to take steps to fill those gaps. Additionally, this presentation will be geared towards those with cylinders and concentrators, although many of the principles are the same for those with piping and liquid oxygen. So moving forward, why should we track our system? Tracking your system provides you an understanding of the supplies available to you, and I think equally as important, the supplies that are not available to you. Because when patients are coming to your hospital, you want to know how to be able to best provide for their needs. So it's important to understand the supplies that are available. Additionally, tracking can help you understand how patient surges due to pneumonia season, influenza, or COVID-19 will affect your supplies. And lastly, in so many places around the world, resource gaps are simply a part of life. And so tracking your system can provide you important insight to those resource gaps and also allow you to create a plan to work through those gaps. So these are some of the reasons why we should track our systems. But I think the question to ask is who benefits from this tracking? If we're going to put the time into it, who benefits? And so there are many benefits to tracking your system and many different groups who benefit as well. So let's look at clinicians. It can help make work easier by having supplies more easily accessible. By projecting when supplies may run out, it may make it easier to restock before the supplies are completely gone. Additionally, when hospitals track their oxygen systems, it helps clinicians understand when needs will arise and allows clinicians to have a solid foundation of information to advocate to leadership for the supplies that they need. And when needs are communicated and supplies have become available and accessible, it allows clinicians to provide better care to their patients, which is the ultimate goal, right? Next is the hospital leadership. In addition to clinicians, tracking the oxygen system can also provide benefits to the leadership. So when hospitals have systems in place to track oxygen usage, needs, and accessories, it can help hospital leadership to understand the total number of patients clinicians can treat with the oxygen. Additionally, it allows them to work with clinicians and the purchasing department to plan for patient surge during seasons when hospitals can expect to see more influenza, pneumonia, or trauma patients, or any other situation that may cause patient surge, such as COVID-19. And it helps leaders be keenly aware of the oxygen system at their hospital. It can help them decide how best to allocate resources and lobby regional leadership for supplies. And then I think the most important group that benefits from an oxygen system that is well tracked are the patients. And by tracking the oxygen system at your hospital, by being aware of when to restock, and by knowing when and what needs to advocate for, it provides patients better access to oxygen therapy and helps them get necessary treatments faster. It ensures no patient age groups are left out. I think we see oftentimes when supplies are scarce and hospitals are waiting for more supplies to arrive, clinicians have to make the hard decision of which wards receive oxygen and which wards do not receive oxygen. So tracking the system and being able to respond to supply needs before they arise can help alleviate the tough decisions of who can and cannot receive oxygen. And so while there are many benefits to tracking your oxygen system, it's important to understand that there is a cost. And this cost largely is time and effort. So this time and effort that is needed is to measure the entire oxygen system, not just the volume of oxygen available. So this can include many things: understanding seasons of patient surge, tracking how often cylinders need to be refilled and schedule refills in advance, and having a maintenance schedule for concentrators. It also includes tracking how often accessories are used and when they will need to be replaced, reaching out to hospital and regional leadership for resources before the need becomes critical, and just many more things that play into the oxygen system. So the time investment will depend largely on hospital size and oxygen supply type. So larger hospitals and hospitals with cylinders potentially will require more time. And what we've seen is that hospital staff time is the most consistent barrier to tracking. Hospital staff and leadership are consistently busy with full schedules and serving patient needs. But I think it's important to note that tracking resource gaps in oxygen may require doing things differently than we have done before. So it's important to keep in mind the need to change hospital systems to accomplish this goal. And so some of our panelists, Jim and Benjin, I wonder, do you have any examples of innovative solutions in hospital systems around oxygen or maybe asset management?
Well, I'll go first. So one of the things that we've noticed and we've started implementing in some of our program hospitals that receive our healthcare technology management related interventions is the use of asset management files. And we've seen a wide range of this, something even as basic as an Excel file can help. And so there are several program sites of ours that have accurate inventory, and they update the inventory on a monthly basis. And they're able to see exactly how many oxygen concentrators they have at a facility, how many ventilators they have, how many pulse oximeters they have. And because they have accurate inventory, they're able to also then create a health technology management plan for these medical devices. And so they're able to plan for the maintenance, and they're able to plan for the use of these devices. And so this includes accounting for the accessories and consumables that are needed. It sounds like a very basic thing, but this is not done in many hospitals in the global South. And we're starting to see a shift as people are becoming more aware. And so we encourage all of you at your facilities to see if you have a biomedical technician or biomedical engineering teams that have inventory and asset management system for your medical equipment, because this will be very critical for you to know what accessories and consumables you'll need and what budgets you'll need to set aside for ongoing use of your equipment.
Yeah, I'd like to add, Benjin, I think that that's a really good point. And one of the things that happens so often in the clinical setting is that the leadership role that is filled by doctors in hospitals is so important that oftentimes the staff that supports the doctor's orders, so to speak, may be, I would say, very conservative to speak up to the doctors and to let them know what their needs are, because they highly regard the doctors, and that's appropriate. But sometimes the doctors will also depend upon the staff to let them know what their needs are. If they're concerned that the equipment's not working properly, or if they're concerned that they're limiting their supply of oxygen, or that the patient's needs aren't being met. And while it's always important to maintain proper professional decorum and respect, I think that one thing that is very helpful to patient care is to have the best possible communication between the doctors and the staff that attends to the patients in between the doctor's rounds. And I think that that kind of communication, if the doctors can welcome it and the hospital administration can encourage it, and if the nurses and the technicians and the other clinicians can be proactive, there'll be a greater awareness of what the need is. I use the example that sometimes the doctors or even the director of the hospital may not know what actually are the conditions in the hospital unless someone tells them. And so that example, Benjin, that you were giving of that kind of staff, whether it's about technical equipment or clinical care, needs to be something that's communicated, and if it can be documented so that it can be shared, health systems will certainly be strengthened in that process. Trevor, back to you.
Awesome. Thank you, Jim and Benjin. I appreciate what you had to say. So moving on, talking about oxygen systems, I think here's where the bulk of our conversation is going to be, is how do we start? So how exactly do we begin to undertake this large task of tracking our oxygen systems? I'm going to go through this list that we see here quickly, but we will discuss each item more in depth in the coming slides. So to start, we identify the top 3 resources that limit the number of patients you can treat. Check your system to ensure you are providing oxygen safely. Identify the people responsible for monitoring the system regularly. Decide who needs the information you collect. And then make a plan to adapt to what you find. And there are many guidelines available on how to achieve these steps. And we've been working to reference the most useful ones for you. And so as a quick reminder, we have created some worksheets on the LearnWorld platform to help you move through these items. So first, let's look at oxygen as a system. While the volume of oxygen, medical oxygen, is usually the first limiting factor for the number of patients that can be treated, other factors are also very important to consider. So cylinder transportation expenses, distance to oxygen plant, how many days it takes for the cylinders to be refilled. If you're using concentrators, then reliable power source is also critical. So do you get your power source from the power grid only, or do you have a backup generator and fuel? Additionally, accessory management is also a very important thing, as Benjin was talking about. Often hospitals we visit will say they don't have enough oxygen, and after we've worked with them to increase their oxygen availability, we hear that they're not able to treat patients because they don't have enough accessories. So that's where accessory management comes in and is also important. It's also important to keep in mind that we need to think of getting oxygen not just into the doors of the hospital, but into the lungs of the patients who need it. So in order to do this, we have to measure all the things that could limit the number of patients we can treat, whether that is oxygen transportation, concentrator power supply, available accessories, or any other kind of thing that could have an effect on our system and ability to treat patients. And so let's take a look at the cylinder system next. And so if you're a hospital that uses cylinders, then there are many parts to consider, as you can see here. So all of these things can limit the number of patients who can be treated at your hospital, as well as affect their safety, the patient's safety. And so how many cylinders do you have at your hospital? How long does it take to get them refilled? Do you have to rent transportation to be able to get the cylinders from your hospital to the plant and then back to your hospital? One thing that is worth considering is splitting up the process for refilling the cylinders. So for example, if you have 20 cylinders at your hospital, maybe 10 of them are full and maybe 10 are empty. Instead of waiting for all 20 to be empty to get them refilled, maybe you could send the 10 empty ones off to get refilled while the hospital continues to use the 10 full ones. That way there's always oxygen available at the hospital. Some more things to consider: accessories. Do you have enough regulators, flow meters? Do you have enough face masks and cannulas? If you know there's going to be an influx of patients, the hospital can increase the number of cylinders it has. But if it only has 2 regulators and 2 flow meters, then no matter how many cylinders the hospital has, the hospital can only treat 2 to 4 patients at a time. So that's why it's also important to pay attention to the accessory side and not just the availability of oxygen. And then, does the hospital have diagnostic tools like pulse oximeters? And do clinicians also know the appropriate amounts of oxygen to prescribe patients? So all of these things are important to keep in mind when thinking of cylinder systems. Let's see, Jim, do you have any examples of things where items like these have been limited to the number of people you can treat, or how it's affected patient safety?
Absolutely. And sometimes what's very important is for people to, within the hospital, have an agreement in advance to communicate between wards, because it may be very possible that in limited resource settings, there may not be enough regulators that fit, or cylinders maybe need to be shifted. Sometimes many of the cylinders will be prioritized appropriately to the intensive care units and the neonatal ICU, but it may be possible that that we need to shift some oxygen to the pediatric ward, and so we need to really always bring that spirit of cooperation between even wards, and to be careful to have an awareness of where those resources may be available so that they can be shared. I've met clinicians who said, "Oh, we're out of oxygen and we can't provide the oxygen that this patient needs." But I had already visited the other wards and I knew they had extra cylinders, so I was able to say, "You can meet with the department head of the other department and they'll shift the cylinders." And so these are the kind of things, again, that have to do with communication and not being afraid to speak up and be the advocate for the patient. That the clinician can be when there's a need such as that.
Awesome. Thank you, Jim. I appreciate the insight into that. And, interward sharing, all of that can be very tricky, and we know that, and so that's why it's just all the more important that there be a lot of intentional effort put into this, tracking your oxygen system. And while we're still on the cylinder system, again, just a reminder, we do have a worksheet on LearnWorld that helps you track your cylinder system. So please access that, download it, and utilize it. Next, let's look at the concentrator system. So again, similar to the cylinder system, we do have a worksheet for the concentrator system available to you. And also, if you were on last week's call, you might recall learning about concentrator maintenance. So if you want a refresher, I would encourage you to go back and listen to session 5 as well. So looking at this, all of these things that you see here on this slide, all of these things can and have limited the number of patients who can be treated, as well as affected patient safety. Things like power supply. So, do concentrators have a steady power supply, or do they need backup generation? Do they have extra fuel for the generators? Also, do biomedical technicians have a maintenance and cleaning schedule for the concentrators? So if there is not a regular maintenance schedule for your concentrator, then you run the risk of it breaking down or not being able to treat patients, which means if it breaks, immediately there's less patients that you can treat. So it's important to look at that. And one of our panelists, Gunalan, he, professional biomedical engineer, lots of experience as it relates to training and especially oxygen concentrators. So Guna, would you be able to share a little bit about your experience of what you've seen in the field as it relates to concentrators?
Yeah, sure. Most of the concentrator that you see in the field is you're going to see a lack of maintenance and never been tested. That's a normal thing that you're going to see. Ended up, the concentrator is not going to perform at all. So maybe you get 40% output, but they think the oxygen concentrator still works and they are using it, but you are not delivering exact oxygen to the patient. So that's very common, and most of the oxygen concentrator, they got an alarm system that going to tell you exactly what's the problem, but they don't really look into that. So eventually the machine is not working properly, all this. So the filters are very important, need to be replaced accordingly, like 10,000 hours, you need to replace the filters, all this. If you perform that particular maintenance, the lifespan of oxygen concentrator will be longer. So 40,000 hours is equal to almost 5 years non-stop use if you really maintain it, or 2.5 years, depends on the condition how you maintain. Okay.
Yeah. Hey, Guna, thanks so much for that. That's incredible that maintenance can, almost increase the lifespan of the machine. So no maintenance, you said 2.5 years, but maintaining it lasts 5 years. So, maintenance is so important. So again, I would encourage you, go back and listen to session 5 if you want some tips on how to maintain concentrators. So next, let's take a look at identifying some of the things that could affect the hospital's ability to provide oxygen. So let's identify the bottlenecks in our systems. So it starts by identifying what you have, then using tools such as the worksheets that are available to you in LearnWorld to estimate how much oxygen you might need and what other things you should consider. So when we first start, normally the number of oxygen cylinders or concentrators limits the number of patients that can be treated. That's typically the case. We see that across the board. That's always the first thing people say, we don't have enough oxygen. However, as we increase the volume of available medical oxygen, we find sometimes we can't use all the oxygen because we're missing other key supplies or systems. Or we may be able to provide oxygen, but we are not able to provide any oxygen to key age groups like neonates or pediatrics because we don't have the right size accessories, which is very important. Regulators may not fit cylinders, flow meters may not fit wall outlets, or certain wards or hospitals may not have access to oxygen or pulse oximeters, even though these things are present at the hospitals. So that's why it's important just to identify what's available and what's not available to both the hospital and at the ward level, and to patients by age, such as neonates, pediatrics, and so forth. And so that's why we measure all of these things that can hinder patient access to oxygen. Things like supplies such as oxygen and accessories, things like utilities such as steady power source and backup power source. And we measure things like our systems such as cylinder refill schedules and concentrator maintenance schedules, and things like staffing needs. So do we have clinicians trained in oxygen therapy? Do we have technicians to maintain concentrators? And do we have sterilization staff who can clean accessories? And so all four of these areas, supplies, utilities, systems, and staffing needs, if we're missing out in these areas, it hinders our ability to treat patients effectively with oxygen. And so after identifying some of the bottlenecks in our oxygen system, we check the system for safety. Very important. Safety is a huge thing to always consider. And safety in the oxygen system covers more than just over-oxygenation, okay? It covers oxygen purity levels in concentrators. It means understanding safe transportation practices for pressurized oxygen cylinders. So, when you look at the cylinder, there's a valve on top, and these cylinders are very high pressure. And if it falls over during transportation and that valve gets damaged, that cylinder essentially becomes a high-speed bullet moving through your hallways and your wards, and can very much hurt people. So safety, huge. When you're transporting cylinders, have a safety cap on that one. Safety also includes making sure you have access to appropriate accessories for different ages. So neonates and pediatrics require different size cannulas and face masks. So having those kinds of things can help you safely provide oxygen. Safety also includes correct sterilization techniques and reuse of single-use oxygen accessories. Want to acknowledge it's a fact of life. When supplies are scarce, sometimes you need to reuse a single-use item. So it's important to properly sterilize them and know that you cannot reuse them indefinitely. So you need to keep track of how many times those single-use items are in fact used. Additionally, safety does include cleaning and maintaining oxygen equipment. As Guna was mentioning, maintaining actually increases the life of some of your equipment. And if we even look here at this cylinder picture, you can see there's tape all over the valve, all over the gauge, all over the humidifier. If you maintain your equipment, if you take care of your equipment, you can avoid much of what you see here in this picture simply by just taking proper care of it and cleaning it and appropriately storing it. And so one experience that I've had when I've gone to some hospitals, in the humidifier, we've even seen algae growing in the humidifier water. And so just even think about that. Patients on oxygen from this cylinder where there's algae growing. And so all of that's just, they're breathing it into their lungs. And so that's not okay. That's not acceptable. And so that's why we do have an emphasis on patient safety as a part of tracking the system to make sure there's no gaps, or where there are gaps, we can fill those gaps quickly. So now that we've talked about identifying needs and resources, and we've identified some safety points, I think an important question is whose job is it to do this work? Who are we going to have that actually does the tracking? And so we recommend that hospitals put together a team of people, each with different responsibilities to ensure that all parts of the system are tracked and maintained. So the person who tracks supplies and the person who monitors safety, they don't need to be the same person. It's okay to divide up responsibility as long as frequent communication takes place, as we've been emphasizing. And I think that's still always going to be one of the key things is communication. So if your hospital is large, it might even be worth having somebody in each ward track supplies. But again, it comes back to communication. I think oftentimes when we're inside of a team and a request is made of our team, many times we see that request, that task go unfulfilled. And I think it's simply and easily due to me as an individual thinking that my team member will take care of it. But there was never any communication to actually verify who would take care of it. So that's why it's important to be very, very specific who is responsible for each task as it relates to tracking the oxygen system at your hospitals. Okay, so now that people are doing these tasks and the system is being tracked, what happens with all the information that is being gathered and monitored? So the whole reason for this tracking is to gather all this information. And so now what do you do with that information? Again, I'm always going to emphasize this: communication is absolutely critical. Communication from you to your peer, and communication from you to leadership, and communication from you to the people that work underneath of you. All around, you need to keep in constant communication. So there are many times that we collect data and don't analyze it and don't tell anybody about it, but that is what needs to happen in order for this tracking system to be successful. We need to talk about what we have found and identified, and we need to talk about it with other people. So here are some of the people who need to know what you know, where communication needs to flow. First we have the clinical teams. Clinical teams need to be able to locate the supplies. They need to know when patient surges are expected. They need to be able to request supplies and have access to training resources. Purchasing department, the purchasing teams need to understand which items are most critical to treating patients with oxygen therapy, which accessory sizes are missing, and which model of replacement parts are needed. For this one in particular, I think we've seen all too often when we ask clinicians, hey, why don't you have a certain regulator or flow meter? And they respond, well, we told the purchasing department we needed one. The purchasing department contacts the supplier and says, we need a regulator. The supplier says, okay, which one do you need? And the response almost always, the cheapest one. And it turns out that whatever that cheapest one was didn't fit the oxygen cylinder. And so that's why it's very important to be very specific with each of these groups and every single person you come into contact with. Be very specific with what the needs are. Next, you have the technicians. The technicians need to know about and communicate the state of oxygen concentrators and need to be made aware of any alarms that are sounding. Guna, real quick, can you tell your story about the alarms that you found and the situation with those?
Yeah, some of the technicians the alarm is really annoying, all that. So what happened is they try to intend to not diagnose the device, but they intend to cut the alarm. So you still got the same problem running in the machine, but what happened is the alarm is missing now. So they cut the buzzer inside the system, and they don't really repair the machine actually. So this is what happens.
Yeah, and so the alarms, they help know if there's something wrong with the oxygen that's coming out of the concentrator. And so when the alarm is sounding, it's saying, hey, there's not enough oxygen coming out. You need to check something. But instead of responding to that appropriately, cut the alarm, and then now you're using this concentrator on a patient, and they're not receiving the pure amount of oxygen. And so that can definitely affect patient health simply by not telling anybody or by doing something that shouldn't be done. And so that's why it's important that you keep in constant communication. And so the next group, probably one of the most important groups that really need to be aware is leadership. Leadership need to know what top items are critical for treating patients with oxygen therapy and what gaps currently exist in their hospitals. And as Jim mentioned, it can be very it might seem odd to make requests of leadership or to tell them what's wrong or what's going on. It can be hard to approach leadership, let's say. But it's very important to get them this information, because they are not able to make an informed decision unless they know what you know. And so communication is absolutely critical. So something that goes hand in hand with this idea of communication is making a plan. Okay, so once you've identified the different groups of people involved in this chain of communication, it would be a good idea to have people from each of these groups come together and actually strategize, talk about what needs to be done, make a plan. And so, often we think that once we collect the data, we're done. This is not the case. If you stop after you've collected the data, you've done 80% of the work, you've only seen 10% of the results. And in reality, if you've collected data and done absolutely nothing with it to inform your decisions, just to be honest, you've wasted your time. And so that is why it's important to do the next step after collecting the data, after tracking the system, and that is making a plan as to how you're going to address the system to make it stronger. And so I just want you to remember this: collecting data is not the goal. Using the data to make an informed decision is the goal. So we're not done until we ask questions about what the data means and then put our findings to use. So throughout the worksheets that we've provided to you in LearnWorld, we've included many questions and action steps that can help you make the most of your findings. So again, I encourage you to download those worksheets for your hospitals. So when making a plan, here are some possible steps that we have here on this slide. First, let's plan around resource gaps. So if you have cylinders but not enough regulators, try to increase the number of regulators you have. And again, this might seem like common sense, but we've seen this so many times where these lines of thinking may not actually be the case in hospitals. So, we're saying this, even if it seems like it's, yeah, that's simple, I understand. It's important just to take these into consideration. If it'll take a long time for you to get the concentrator or the regulators, then perhaps get your concentrator up and running instead if you're waiting on something for your cylinder. If you primarily use concentrators but have an unsteady power supply with no generator, keep an oxygen cylinder, a regulator, and a flow meter ready as a backup for critical patients, okay? And then next, advocate for the right supplies. If purchasing always gets adult cannulas but not neonatal cannulas, show them the patient numbers that you've been collecting and explain why different sizing is important. I've heard many stories from clinicians where purchasing bought the wrong gauge, the wrong cannulas, the wrong regulators, simply because they didn't understand what was needed. And so if we collect the data and we communicate it, it really helps solve and address this gap of lack of information, and in this case, helps you advocate for the right supplies. And then the next step is remove barriers for use. So if you have cylinders with multiple types of valves, for example, make sure you have a regulator for each type of valve in every ward. And if you have piped oxygen, make sure your flow meters match your wall outlets. And then one thing that we consider very important is hire a technician, hire somebody who's able to come and address actual mechanical problems. So if you're concerned about your oxygen concentrators, now is an ideal time to find someone to check the oxygen purity. With the need for medical oxygen arriving due to COVID-19, get your oxygen concentrators serviced before they break. If you can't find somebody, do the basic cleaning steps described in the previous session. So again, I would encourage you to go back to session 5 as it relates to concentrators and just do some of those maintenance activities. And so maybe just a question for the panelists at large. Are there any things you want to mention as we talk about making a plan?
I would, Trevor, and you mentioned this, you touched on this a little bit, but make sure that when you make plans that you don't make it in isolation. Get the teams to be as diverse as possible. Make sure your biomedical technicians, your technical staff are involved in the planning process. That way you can, they can give their feedback, and they can follow through on delivering some of the aspects of the plan that pertain to them. So make sure the team is a diverse team and has multiple departments represented, including your clinical departments, your biomedical or engineering departments, your accounting or finance or procurement teams. Make sure everyone's involved. So.
Do any of the other panelists want to add anything before I jump back in?
I think your slide looks good, Trevor.
Awesome.
I think that each one of those key points is a particular item that everyone in the hospital can use. And by the time you put those items together, you'll be using the data. And I think that that's what's most important, is not that you just simply record what your needs are, or what the gaps are, or what the barriers have been, but you use that as a guide on how to move forward with your program.
Yeah, absolutely. Thanks for your guys' insight. Benjin, I absolutely agree. Diversity in your team, bring leadership into your team, bring people from different wards, different skill backgrounds, and make a plan that is known by not just the team, but by all throughout the hospital as it relates to this. Very important. And so just to go over a little summary of what we've talked about, we hope that we've been able to provide you with some confidence to identify the barriers that limit the number of patients you can treat, to check your system to ensure you are providing oxygen to patients safely, to identify and put together a team of people who will be responsible for monitoring the oxygen system regularly. But also we want you to feel empowered in your planning and empowered in your communication. So to kind of sum it up, if you get anything out of what we've talked about so far, is that first, we hope that you will be able to identify your barriers to oxygen therapy that go beyond just simply not having the volume you need. And second, that it is important you do not stop at just collecting the data, but instead you share the data you collect, and that you use this data in the teams that you've formed to make a plan. So sharing information helps other people make informed decisions. And so thanks for participating in this session. And I want to throw it back to you, the audience who has signed on, if there's any questions that you might have for us.
Hi, Trevor. Some of the questions that came in through the Zoom invite, you've addressed most of them, but we did have one question that maybe I'll pose right now, and it was, what do you think are the biggest challenges to hospital-based monitoring for your oxygen supply? And for those challenges, what do you think are the best strategies or solutions? Kind of a big question.
Yeah, certainly. I'll leave room for panelists to answer, but I think maybe off the top of my head, I think it goes back to the data or the information you collect, and not collecting it alone. So together as a team of people, understand where you're at with how much start with availability, how much oxygen you have available to you, whether that's cylinders or concentrators. But then move beyond that. Try to understand the patient flows at your hospital. So going back and looking at patient registers to really get an understanding of just how many patients come through your hospital at any given time or any given season, and so you can be aware of the supplies that you'll need when those seasons or months re-emerge. And then really just keeping track of that and constantly monitoring that. And then going into that next step is what supplies do you have available to you. So all of this plays into the difficulties of monitoring, because you do it once and then you have the information, but information constantly changes because every single day is a brand new day. Every month has its own set of challenges that come. And so that's why it needs to be a team, and it should be an ongoing endeavor to keep on top of the data as it relates to patient flows, as it relates to what oxygen is available to you, what supplies are available to you, and then clinical trainings, how to use those supplies. I'll pass it off if there's any other panelists who want to add to that.
Trevor, I could add a little bit to that in what I've seen in so many hospitals around the world, and it seems to be the same whether it's in the South or in the East or in the West. And the business of managing patients and patients' flow is typically all-consuming by itself. Doctors have so many patients within their charge. Nurses and other clinicians have so many patients to take care of that oftentimes they're so busy just urgently running from taking care of one patient's need to the next patient's need that it's difficult to stop and step back and adjust the system so that the system can help serve them, so that they don't have to work so hard or be distracted to find that mask, that cannula, that regulator, that oxygen cylinder. But when a system like this, Trevor, that you've presented can be established at the beginning, it can maybe save the work on the part of those doctors and nurses that are all working so hard to provide patient care and are so oftentimes overloaded with patients' needs. And by changing the system at the beginning, it can actually alleviate the work and improve the patient care in the long run.
Great. I'm not seeing any more questions in the chat, but maybe I'll ask just one more that came in from the Zoom invite. Someone mentioned that sometimes the biggest barrier to creating a system is a culture where there just isn't that culture to keep records or to do all the sort of system planning. From that perspective, what do you think are some of the best strategies to addressing maybe the mindset that maybe this isn't the priority, or that it is deprioritized when other things come up?
Benjin, I know you have a lot of experience with teaching technicians how to actually track things where they haven't been tracking before. Maybe do you have any suggestions?
Yeah, this is it's a loaded question, huh? I know with biomedical technicians, when we've worked with them, and as we continue to work with them, in the middle of all of the technical trainings that we provide and the skills development opportunities that we create for them, we make sure to remind them first and foremost what this is all about. Patient safety is at the core of the biomedical engineering profession, and making sure that the devices are maintained properly involves making sure that you have an accurate inventory and that you're tracking that inventory. In preventive maintenance and corrective maintenance activities that allow for a device to be tested and be safely used on a patient ultimately is saving lives. And so, so I think it's very important that, at least for biomedical engineering professionals, to remember that even though, you know, it's maybe an added responsibility. They weren't tracking before, but now they have to track, and it's an added responsibility. Ultimately, it's making sure that you reduce risk, and that you give every child, every mother, every father that comes to a hospital, you give them a chance to leave healthy and be healthy. And so I think that is very important to keep that at the forefront. Almost on a daily basis, some of our biomed teams, we have them print this type of, you know, information and stick on the walls in their workshops. That way they can look at it and be reminded that even though it may be mundane to track the Excel files and monitor and talk about it and analyze the data and talk about it on a monthly basis, ultimately this is about saving lives. And so yeah, that's my 2 cents there. I know, Jim, you've seen a lot.
That's it. I think you summed it nicely, Benjin.
Absolutely.
I won't ask any more questions, but I will note that there was some more clinical-oriented questions that came in through both the chat and the Zoom invite. Unfortunately, Dr. Crawford is having some connectivity issues tonight, so she's not able to join and answer these questions live in person. However, I will share these with her after the session, and I will include her response in the transcript of the question and answer that is circulated in the follow-up email. So we will provide those answers for you. Trevor, did you have anything left in your presentation? Or?
No, I am finished with my presentation.
Okay, awesome.
Get back to
So
you.
I'll close this off then. So I'd say thank you to all of our panelists, our participants, for joining us today. We were super lucky to have the expertise of all our panelists to answer questions and sort of provide their insights. Thank you to all of our participants for joining and engaging with the content. And then also thank you to our funders, Grand Challenges Canada, UBS Optimus Foundation, the GE Foundation, and the ELMA Foundation. As I alluded to before, in the next couple of days, we will be sending a follow-up email that contains links to all of the information shared today, information on how to access the Learn Worlds Resource Center, which is where you can access all of those great worksheets that Trevor mentioned in his presentation, and as well a link to the recording of the session. And then finally, as you can see on the screen, we do have a WhatsApp group set up for the Oxygen series. And so if you have any more questions, we do encourage you to join this group. A number of our educators throughout the series are on there and are actively following up on questions that come up post-session. So you can join either through the QR code on the screen, or we'll also send a link in the follow-up email. And then finally, if you have any questions at all for us, Assist International, please reach out to us at echo@assistinternational.org. Thank you.
Thank you, Alana.
Thanks, everybody.
Thank you, Trevor. Thank you, Alana. Thanks, Jim.
Thanks
Gunalan.
everyone. Right.
Thanks, everyone.